अस्सलाम वालेकुम एंड वेरी वेरी गुड आफ्टरनून आप सब लोगों को who are joining us live on Shifaam कराची वाले बरसात आई होप यू आर सेफ एंड साउंड क्योंकि आज पूरा दिन थंडरस्टॉर्म्स हैं फॉर द रेस्ट ऑफ यू वाचिंग अस नेशनली आई होप आप अपनी सेहत का ख्याल रख रहे हैं दर्द और चीज़ें जो आपको महसूस हो रही हैं उनके लिए रीच आउट कर रहे हैं बिकॉज इट इज़ वेरी वेरी इम्पोर्टेंट टू टेक केयर ऑफ योर हेल्थ और अगर किसी के पास कोई ट्रीटमेंट प्लान है तो प्लीज़ 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 अपने ट्रीटमेंट प्लान्स फॉलो कीजिए और अपने प्रैक्टिशनर से रुजू करते रहें सो आई हैव अ ब्यूटिफुल व्यू मैं बाहर देख सकती हूँ बारिश जो है वो अभी बहुत तेज़ हो रही है सो इफ़ यू आर ऑन द रोड if you are somewhere not safe please get to safe places and अपनी सेफ्टी का ख्याल रखें एंड सेफ्टी के बारे में जब हम बात करते हैं तो इट्स पॉपुलेशन हमारे मुल्क की तादाद हमारे बच्चे पैदा करने की कुव्वत और फैमिली सिस्टम्स और ये बहुत सारी ऐसी बातें जिनके बारे में हम बात नहीं करना चाहते बिकॉज लोग क्या कहेंगे सो वी आर टॉकिंग अबाउट फैमिली प्लानिंग एंड वी आर टॉकिंग अबाउट कॉन्ट्रासेप्शन एंड आज हमारे साथ आहंग की प्रोजेक्ट लीड हैं अनम खान जो हमारे साथ कुछ गुफ्तगू करेंगी बिकॉज दिस इज़ अ वेरी वेरी इम्पॉर्टेंट टॉपिक बिकॉज वी आर फ्रॉम अ प्लूरलिस्टिक सोसाइटी तो हमारे लिए डिसाइड किया जाता है औरत ज़ात के लिए माओं के लिए डिसाइड किया जाता है घरानों में कितने बच्चे होंगे कब होंगे कैसे होंगे कितना वक्फा होगा सो ये सारी वो बातें हैं जिनके बारे में आम प्लेटफॉर्म्स पे अब बहुत अच्छी गुफ्तगू और बातें शुरू हो गई हैं and Ahang is taking a very very active lead on this so let's get Anam with us. Assalamu alaikum Anam, how are you?
Walaikum assalam. Thank you so much for having me on your platform to talk about this very important topic. और जैसे कि आपको पता है कि that Pakistan is one of the fifth most populous countries in the world. So talking about population, talking about family planning, talking about contraception, it's extremely important. So, and Ahang for the last 25 years has been working in the domain of sexual reproductive health and rights for women, children, and adolescents. So and just Rabia आपने कहा, you very well said right that most organizations are now actively talking about family planning and contraception क्योंकि इसकी बहुत ज़्यादा अब need हो गई है because of the alarming population growth rate of Pakistan.
Absolutely. And you know Anam जब हम बात करते हैं तो जो हमारे व्यूअर्स हैं जो हमारे मैसेज हैं एक चीज़ होती है ऑटोनमी एक चीज़ होती है खुद एतमादी खुद मुख्तारी बहुत सारी ख़वातीन के पास अभी भी ये राइट नहीं है कि उनके घराने कब वाबस्ता होंगे कब वो माँ बनेंगी इट इज़ अ वेरी डायरेक्टेड थिंग स्टिल सो जब हम फैमिली प्लानिंग कहते हैं तो अगर आपके पास एक आदमी और एक औरत जिनकी अभी शादी हुई है वो आते हैं तो व्हाट इज़ योर फर्स्ट एडवाइस टू देम
Actually, हमने जितना भी काम किया है societies and हमारे interventions होते हैं and not just with Ahang, even in the previous organizations I've worked in, I mean I've been in this field of family planning. तो हमने एक चीज़ ये notice की है कि that unusual ये होता है कि that when the couple gets married, उनको पता ही नहीं होता है कि that there's something known as family planning or contraceptions. और उन लोगों की कॉन्ट्रासेप्शन या फैमिली प्लानिंग की जर्नी इट बिगिंस आफ्टर दे हैव हैड लाइक लेट्स से टू चिल्ड्रन तो पॉइंट इज कि दैट द फैमिली प्लानिंग प्रोसेस शुड बिगिन फ्रॉम लाइक एज सून एज यू गेट मैरिड उस टाइम पे मतलब यू शुड बी एबल टू डिसाइड एंड प्लान आउट योर फैमिली क्योंकि बहुत सारी अगर आप देखें कि ये जो है Even in our society, it's considered like for young girls, it's given this advice that they should stay away from contraceptives and family planning methods. क्योंकि उनको ये बताया जाता है, actually the biggest problem in our society are these misconceptions and myths, राइट. तो काफ़ी ज़्यादा ये होती है मिसकंसेप्शन दैट आपको ये बताया जाता है कि दैट अगर आप कॉन्ट्रासेप्टिव्स यूज़ कर लेंगे तो इट वुड impact you being pregnant in the future. Yeah, otherwise you will never get pregnant. So there, and we have come across many of these myths and misconceptions क्योंकि हमने बहुत actively काम किया है in rural areas, even in urban areas, and you know people they just don't have that knowledge. So I think the most crucial thing first is awareness and awareness. I mean, through awareness, you will be able to tackle so many issues. क्योंकि अगर किसी को पता ही नहीं है कि family planning, so for example, a woman, उसको पता है कि that she has decided that she doesn't want to have, or the couple to collectively have decided that they don't want to have a child in the first 2 years or whatever is the issue. Um, so then they don't have the means through which they can implement that. या उनके पास नॉलेज नहीं है बिकॉज जैसे कि आपने भी कहा कि ये इन टॉपिक्स पे बात करना इट्स कंसिडर्ड अ सोशल टैबू and it's not very easy to talk about these topics. So that is the main problem that lies and in our
And before
society.
I just want to interject कि आप थोड़ा सा इस पे भी बात कर सकें. जब हम बात करते हैं about our sexual and reproductive rights as women, as men, as humans, तो वो एक जो जैसे हम अपना जैसे हकूक कहते हैं, राइट, जिनसी हकूक, what is the awareness level जब आप बात कर रही होती हैं about colonies and masses and societies में जाके जब आप awareness raise करती हैं, ख़वातीन और मर्द हजरात को क्या अपने sexual rights के बारे में knowledge होती है, information होती है?
It's actually very surprising कि उनको इतनी ज़्यादा information और awareness नहीं होती. And being a woman, like अगर आप जाके बात करें तो वो होता है कि they feel that they are not the main decision makers of their own body or of their own means of planning their own life or their हालांकि if you think about it, it's the woman who has to give birth or the woman who has to go through pregnancy, or it's all, I mean, it's the woman who has to do that, right? But unfortunately, in some of the societies, I'm not even talking about कि जो उनके जो husband होते हैं उनमें right होता है, क्योंकि obviously we know कि in most decisions are actively made by men in society. लेकिन apart from just men, बहुत ज़्यादा इन्वॉल्वमेंट होता है इन लॉज का. वी आर टॉकिंग अबाउट मदर इन लॉ, वी आर टॉकिंग अबाउट लाइक अदर फैमिली मेम्बर्स, मे बी सिस्टर इन लॉ. तो दैट इज़ लाइक अ रियली बिग चैलेंज फॉर अस. तो जैसे कि हमने कुछ स्ट्रीट थिएटर्स भी किए हैं इन रूरल कम्युनिटीज़ एंड ऑल, तो उसके थ्रू भी हमने ये मैसेजेस दिए हैं कि दैट the right of deciding about family planning, it should also lie with the mother, because ultimately she's the one who's going to be bearing the child. So these women don't even know that they have a right about their own body, or that they can decide or they can control. So I remember this one project that I did previously before Aham. So they had a very excellent approach. So उसमें ये था कि counseling, instead of just counseling women, the strategy was to counsel men. Because जैसे कि मैंने आपसे पहले कहा कि that male involvement in our society is very important, because male are the quite influential decision makers of the household. ठीक है, तो अगर आप इनको समझा देंगे और if you get them on board, तो इस प्रोजेक्ट में हमने बेसिकली ये किया था कि जो फैक्ट्री वर्कर्स होते हैं, जो मेल्स होते हैं, तो इनमें हमने बेसिकली जाके सेशंस कंडक्ट करके अवेयरनेस रेज कराई थी. तो फिर दे वर एबल टू गेन दैट नॉलेज, एंड फिर उन्होंने फिर अपनी वाइफ से फिर कनेक्ट कराया, फिर उनके साथ सेशंस हुए, कपल काउंसलिंग हुई. तो पॉइंट इज कि दैट बेस्ड ऑन द सोसाइटी, जैसे कि बेस्ड ऑन पाकिस्तान सोसाइटी, आपको ये देखना चाहिए कि व्हाट विल वर्क हियर. कि अगर आपको पता है कि मेल इज़ अ मेन डिसीजन मेकर, तो फिर आपको उनको भी टैकल करना होगा. क्योंकि क्या आपने जाके किसी हाउस में आपने डोर टू डोर काउंसलिंग की और आपने यू टॉट द वुमन, ठीक है, आपने उसको बता दिया फैमिली प्लानिंग, लेकिन शी इज़ अनएबल टू कन्विंस हर हस्बैंड. सो दैट्स like a lost cause, right? So that is why it's so important to have like the male involvement angle as well in this, and also to counsel other people who are also part of the decision making process of family planning. Other than
and
that,
and
yeah,
that
so I'm sorry, I couldn't. I think your voice is breaking.
saying about mindset.
Ravi, I think your voice is breaking. I can't catch your question.
And are we back now? Are we back?
Um, yeah. So basically, what I was talking about earlier, that basically the impact that it has on women, and the impact that it has on other members of the family. So that's important. अच्छा, I just wanted to divert the conversation कि हम family planning के बारे में क्यों बात कर रहे हैं, family planning या contraception, that why is it so important to discuss it, कि अब जो है why are these NGOs and other like organizations actively working towards family planning, and the main reason is overpopulation. अगर आप ओवर पॉपुलेशन की बात करें तो ओवर पॉपुलेशन का जो इम्पैक्ट होता है, इट हैज़ एन इम्पैक्ट ऑन every aspect of the economy, and not only that, but it also has impact on every resources. So agar if there's overpopulation, it impacts like education, it has an impact on food, on health facilities, on jobs, on infrastructure. So as the population is increasing, so the demand for food, the demand for health, the demand for infrastructure, the demand for education, everything is increasing on the government so that they can ensure that all of the services can be provided equally to all of the people. But क्योंकि population इतनी ज़्यादा बढ़ रही है, तो आप you can see कि हम when you look around, अगर आप हमारा infrastructure देखें, या फिर आप ये देखें कि that so many people are out of jobs. If you see that there's so many people who are under the poverty line, and if you see like, so all of these factors that we are facing in our society, अगर आप population जो है इसकी जो growth है, if you're able to manage it better, तो जो जितने भी resources होते हैं, that you'll be able to manage them better. तो आपको क्यों लगता है, like for example crime की अगर बात करें, the increase in crime, so all
Yeah,
of these factors, like, because there's so much of a strain on the resources of the country, the economic resources, the financial, all resources. और I'll just be sharing some alarming statistics with you, जैसे कि अभी जो growth rate है पाकिस्तान का, annual growth rate is 2.4%. अगर यही growth rate चलता रहा, so you would be needing by 2040 around 117 million more jobs. You will be needing 19 million more houses. You will be needing 85,000 at least more primary schools. The point is that uh, the, जैसे कि अभी now I think the audience will be better able to understand that why it is important to talk about family planning, why it is important to talk about contraception, and you know how these factors are considered a social taboo. अगर like people knew about this, ठीक है, अगर लोगों को knowledge होती, the women knew about it, the males knew about it, or whatever, if people knew about it, or if this was actively talked about, तो इतना ज़्यादा pressure नहीं पड़ा होता on the resources of the country, right? So that is why
absolutely.
it's important. Or you know, the most alarming thing is that on an average, every couple, or like every other couple on an average, has one unintended child. So that means that you had not intended that child, but uh, so that just means that आपने जो family planning method नहीं use किया होगा, that or that child came as a surprise. So you know what I'm trying to say. So
Yeah.
this is how alarming the situation is.
And I would also like you to bring in, I think ये एक बहुत अच्छा time है to toy with the idea of how 2020 and 2021 was in terms of overpopulation, because through the stats I believe that it was one of the most baby generating years. COVID was one of the most baby generating years for Pakistan.
Okay, so as you know that the pandemic that came in March 2020 has had a significant impact on the population, in the sense that it had, see, when the pandemic came, so nobody was prepared for it. The pandemic has had an impact on every walk of life.
Yeah.
So with regards to businesses, job, people going out of jobs, people having an impact on businesses, not having much access to mobility. So there were many factors that got influenced.
Mhm.
And also for the first, like for 2020, people didn't even know like कि इसको कैसे handle किया जाए pandemic को. And you know, the fact of the lockdown, that we were kept in a situation of lockdown, and that had an impact on our mobility and our even our mental health and all these aspects. अब इससे हुआ ये कि that obviously when you are in a state of a lockdown, so you are, or people are working from home, so you are spending more time with your partner,
Mhm.
right? So that is one aspect. So जैसे कि on a regular day, like pre-COVID times, uh, you know, the like people go out to work, they go out from their houses. But in the state of the pandemic, you're always with your partner, or you're always with your spouse or whatever. So that is one aspect. ठीक है. The other aspect is कि because mobility इतनी नहीं थी, transport, like women cannot access transport, so they weren't able to go to clinics. They weren't
Mhm.
able to go to their, like to healthcare providers if they want to seek help in, let's say, family planning methods. और ये मैं short term method की बात कर रही हूँ कि that requires like perhaps more counseling, yeah, you need to go to the clinics or whatever. So that was another impact. So clinics not being able to access. The other thing was that अगर आप demand की बात करें, so the demand for family planning was much high, and obviously it had an impact on supply. So supply में ये था कि uh, that because of everything being closed, so the availability of products or running out of the product on in pharmacies or in shops or whatever, so that had an impact.
Mhm.
And तो ये काफ़ी ज़्यादा, you could see it was quite a situation in family planning. तो अब आप देखेंगे हर चीज़ में, नॉट जस्ट द डोमेन ऑफ फैमिली प्लानिंग, पैंडेमिक केम इन 2020, लेकिन उसका
Mhm.
अभी भी इम्पैक्ट आ रहा है इन 2022, एंड आई थिंक आगे जाके भी इसका इम्पैक्ट आएगा. कोई जैसे कि अगर if you see that the rising prices of things around the world or all of these things, it's all like हालांकि ये पेंडेमिक 2020 में आया, लेकिन उसके जो कॉज इफेक्ट्स हैं, they're going to persist for the next couple of years, right? तो
Mhm.
इसी हवाले से अगर आप देखें कि that you know, if couples conceived in, let's say, 2022 or 2021 or whatever, so obviously the children will be born in the like next year or whatever. So that's what I'm trying to say. So it has had quite an impact.
Right. And you know, as we हम जब statistics की बात करते हैं, and we are talking about this encroachment and crowding in terms of resources, there could be economic resources, there could be social resources, environmental resources, मतलब काफ़ी सारी चीज़ें हैं. हम जैसे कि आपने एक चीज़ बताया, आपने स्टार्ट किया about how many schools will be required, right? एंड हम वो लिटरेरी अवेयरनेस के तरफ नहीं तवज्जो देते, राइट, बिकॉज वी आर हेस्टी इन आर प्लानिंग. हम प्लान, जैसे कि आपने बताया कि जब दो बच्चे होते हैं तो हम रुजू करते हैं टुवर्ड्स फैमिली प्लानिंग. So if we were to talk and if we were to raise awareness, Anam, about okay, when we are not just talking about empowering men and women to have a choice. हम बात कर रहे हैं about reducing economic slumps. We are talking about making improvements. But when we talk about and we can tie up contraception in this also, when we talk about preventing, say, for example, teenage pregnancies, unwanted pregnancies, when we talk about sexually transmitted diseases, or when we talk about the mortality rate of mother and babies. And ये सारा एक system बन जाता है, right? It culminates into a system. So when we are reaching out to the masses, when we are reaching out to the women and men and empowering them, तो हम उनको किस तरह बता सकते हैं कि it is not just, again, economics empowerment, but it leads to the welfare of mother and child also.
So, अगर आप mortality rate की बात है, like maternal deaths, right? So, women basically passing away after giving birth or during giving birth, you know, that basically that process. So, if we're talking about that, on an annual basis in Pakistan, so 11,000 maternal deaths occur. This is, I'm talking about reported deaths. So we're not talking about the ones which are not even reported or which happen in, like, let's say, in very far-flung rural areas जहाँ पे
Right.
मतलब ज़्यादा मतलब knowledge नहीं है और मतलब that doesn't get reported basically, ठीक है? तो what I'm saying is that अगर अभी जो हमारा जो contraception prevalence rate है पाकिस्तान का 34%. If this was like, let's say, 55%, we would have been able to save 3,800 mothers on an annual basis. So that just shows that how important it is to use contraception. Or the other thing is that ये जो अगर हम young pregnancies or teenage pregnancies, and even like if you know the problem of early child and forced marriages. So children getting, like, I mean, young girls getting married so young. So in our interventions we have educated young women and men the importance of knowing about family planning and contraception, and the importance of planning a family. Because agar aap dekhe that some of the maternal deaths that are occurring is that the young girl is too young. ठीक है, तो that directly has an impact on the health of the mother and ultimately the health of the child. So she is not, let's say, strong enough, or her body wasn't ready enough to carry that pregnancy. ठीक है? So that's one aspect of looking at it.
Sure.
अब उसका influence obviously has on the child as well, that the child ends up being underweight, malnourished, or there's also obviously the infant mortality rate that occurs, right? So what I'm trying to say is that अगर इसकी जो knowledge है और इसकी awareness पहले से दी जाती, so it would have made a huge difference. And I also feel that abhi jo hum interventions that we do, or like that Ahang does, that we're raising awareness about sexual and reproductive health, and we're raising awareness like even the projects that we're planning in the future, that we're conducting sessions and for young people, like young women and men even before they're married. क्योंकि I think that ज़रूरी नहीं है कि जब आपकी शादी हो जाए फिर आपको काउंसलिंग दी जाए रिगार्डिंग फैमिली प्लानिंग, और वो मतलब आप गेटिंग मैरिड अगर आपका एक सेशन हो जाता है, लेट्स से one touch session regarding family planning and contraception, I don't think that it syncs well. ठीक है, क्योंकि आप इतने साल से जो आपकी thought है कि that let's say like that इतना ज़्यादा प्लान नहीं करना चाहिए और सब कुछ अल्लाह पे छोड़ देना चाहिए, या all these kind of things, अगर आप अब पहले से काउंसलिंग शुरू कर देना from a young age के that even before the like you get married, so you're better informed, you're better able to make decisions, you're better able to plan your family. And why is it important to plan the family? Because ultimately you will be able to provide those resources to your family members, to your children, because obviously our aim is to give a better life to our children. अब जिन लोगों के like have huge family sizes, we're talking about in rural communities, like 6 to 7 children, and they don't have that much means of earning, so it obviously has an impact on the life of the child, or how fulfilled the life of the child could be.
Absolutely, and not just the life of the child. I think again हमारे माशरे में ये एक हमें हमारी अपब्रिंगिंग में एक बहुत ज़्यादा एक बात की जाती है और ड्रेन किया जाता है, हमें ड्रिल किया जाता है कि अब चूँकि शादी हो गई है, अब पूरी ज़िंदगी तुम लोगों के बच्चों के लिए है. तो यंगर जनरेशन जो अब आ रही है, न्यू जनरेशन जो अब आ रही है, दे आर वेरी वेरी फोर्थ कमिंग अबाउट नहीं हमें भी अपनी ज़िंदगी जीनी है. एंड आई थिंक दिस इज़ वाई अ लॉट ऑफ young couples are taking family planning measures and contraception awareness into their stride क्योंकि they also want to live. दे डोंट वांट टू अपनी जिंदगी वो बैक बेंच पे नहीं रखना चाहते जस्ट बिकॉज बच्चों को आगे फ्लरिश करना है. दे ऑल्सो वांट टू, इट इज देयर राइट कि वो भी अपनी जिंदगी एंजॉय करें और जिएं टू द फुलेस्ट. So when we talk about contraception, Anam, and if we were to tell people who will be joining us later or listening to you later कि इस वक्त पाकिस्तान में लोकली आदमी और ख़वातीन और मर्द हजरात को किस किस्म के कॉन्ट्रसेप्शंस अवेलेबल हैं.
Okay, so अगर इसकी बात करें तो so basically there are two main categories. अगर very simply put, so there is a long-term method. You have long-term methods and you have short-term methods. ठीक है, तो short-term methods, obviously, as the name suggests, it's short-term, and it uh, during the time of the pandemic, हमने ये notice किया था, which was quite an interesting trend, कि that a lot of people were moving from short-term method to long-term method. अब इसकी क्या वजह थी? कि that basically because of lack of mobility, because of lockdown situation, because of बहुत ज़्यादा visits to the clinic were becoming like difficult, or visits to the pharmacy, whatever things were becoming a little bit difficult. So which is why they decided to shift to long term method. ठीक है, अगर आप शॉर्ट टर्म मेथड की बात करें तो शॉर्ट टर्म मेथड इज बेसिकली दैट मेथड दैट you can immediately, like, so if you talk about like, as simply put, like condom, so it doesn't have a lasting impact, it's just for the duration of whenever you're having sexual intercourse, so it helps you prevent that. Now अगर हम long term method की बात करें, so that's about like almost 5 years के बाद. So for example, the women gets an IUCD inserted, so that will prevent like pregnancy during intercourse, and उसके लिए you don't need to think about the इसका जो impact है. Short term method में injections भी आ जाते हैं, pills भी आ जाती हैं. Again, इनका जो impact है is not very lasting. As soon as you like stop using the product, or like a few months down, if you stop using the product, for example in the case of injections, so you can get like pregnant again. Now people's fear is to use the long term method क्योंकि उनको ये लगता है कि that when you start using that method, you will never be able to get pregnant again. And हालांकि ऐसा नहीं है. That if you talk about IUCD, अगर हम obviously अगर हम surgeries की तरफ बात करें या more permanent solutions, जैसे कि हमने like in my previous projects we've talked about certain couples that have had like 7-8 children, and then the woman is looking towards a vasectomy, and she thinks that it's important that she doesn't want to have any more children in the future. So I mean, the best thing is that to go and have a counseling and go to a healthcare provider, and based on your health conditions, based on your basically whatever your situation is, whatever your plans are, तो उस हवाले से फिर वो आपको जो है recommend कर सकते हैं, क्योंकि every let's say product or service is not for everyone, right? So then it is better to seek counseling from healthcare provider. Some women are, for example, they use like pills. Okay, some women don't prefer to use pills because they think that every day I need to have it in my mind that I have to take a pill or whatever, right? अच्छा, इसमें we did something very interesting because we wanted male involvement. तो हमने जो males पे जो sessions conduct कराए थे, so this is a very interesting story from the field, that तो male involvement को basically करने में, that because males used to think that they don't have much of a role in family planning, तो हमने उनको as simple as इतनी basic बात उनको बताई कि जैसे कि आप, because the woman is so busy in household chores or is so busy in taking care of the family whatever, तो आप इतना तो कर सकते हैं कि that आप अपनी responsibility ले लें कि that आपको remind कराना है उनको कि that you have to take your pill. So as simple as that. तो इसमें these kind of even small behaviors have a very good impact in the family life. तो फिर जिस इन सब के बाद जो बताए थे कि हाँ हमने उनको रिमाइंड कराया था, and it was good that we're also part of this process, so that we have also like started using short term method, and all these kind of things. So that was a very interesting
That sounds like a very interesting thing. And हम जब बात करते हैं कि यहाँ पे फीमेल स्टेरिलाइजेशन हो गई, कॉन्डम्स हो गए, जो विच आर यूजली द मोस्ट यूज्ड contraception in Pakistan. And yet, जो अब I think in the last 2 years, ever since COVID, data statistics and data collection has become even better because there are organizations like Ahang who are participating in research also. So I'm aware that जब आप field work भी करते हैं, तो there's a lot of stats that you are bringing in, which is also something that we really, really need, to be able to know where what information is available, what are the stats. And आपने बिल्कुल सही बात की about injectables, IUDs and pills. And to be able to know कि एक मेथड जो है वो हर एक के लिए नहीं फ़ायदेमंद होता. हर कॉन्ट्रासेप्शन के भी यूनिक फ़वायद हैं. एंड जाएं कंसल्ट करें और पता करें कि आपके लिए सबसे बेस्ट क्या है. क्या आपके लिए इंजेक्शन जो आपको हर महीने की एक तारीख मुकर्रर तारीख पे लगाना है, क्या वो आपके लिए बेहतर है? क्या आप कंफर्टेबल हैं कि आप नहीं मिस करेंगे अपनी पिल और आपकी बॉडी जो है वो नहीं इम्पैक्ट हो रही किसी वजह से, वो नहीं फूल रही या वो नहीं कमज़ोर हो रही, आपका जिस्म ले पा रहा है, एंड यू आर ओके विद द पिल्स. एंड देन कुछ खवातीन हैं और मर्द हजरात हैं जो बहुत कंफर्टेबल हैं कॉन्डम्स के साथ, एंड वो बहुत एहतियात से इस्तेमाल करते हैं. And so that be it. And the basic idea is कि आपको पता हो कि आपकी strengths क्या हैं और आपकी capacity क्या है कि आप जिसके अंदर अपनी family को safe, healthy and economically savvy रख सकते हैं. One of the things when you were talking about field work, Anna, मेरे दिमाग में आई कि as a person who is leading these projects at Ahang, I'm sure you faced a lot of myths and ill-informed information. So what are your top myths that you've come across and you've been like, nahi, ye nahi hai?
Yeah, so basically there were quite a few, because जैसे मैंने आपको कहा, apart from Ahang also, like in like other organizations that I've worked in the domain of family planning, so they've been very like unusual myths. And some of these myths जो जैसे कि the women that they get it from their mother-in-laws or their elders or whatever. तो जैसे कि एक ही myth है कि that if you start, जैसे कि even before you've given birth to your first child, ठीक है, और अगर आपने फैमिली प्लानिंग कोई प्रोडक्ट या सर्विस यूज करनी शुरू कर दी, देन यू आर डूम्ड. मतलब आप फ्यूचर में यू कैन नॉट हैव चिल्ड्रन, व्हिच इज लाइक द बिगेस्ट मिथ दैट वी हैव कम अक्रॉस. के अगर आप पहले से अगर आप प्लान करना शुरू करते हैं रिगार्डिंग योर फैमिली, तो ये आपके लिए बेहतर है. दैट फॉर एग्जांपल मैनी like couples want कि जैसे कि शादी का जो पहला साल होता है, second year होता है, whatever, they want to get to know their spouse better or whatever the thing is, right? क्योंकि they or for example some couples who get married a bit younger, so they want like a few years that they're not like necessarily prepared for a child. तो अब उनको अगर ये बताया जाए, या मतलब even in communities जो हमने सुना है that even before the first child, if you use this method, then you're never going to have a child in the future. ऐसा नहीं होता है. मतलब it's not like that. If you're using like method, obviously if you've had like a surgery, तो वो तो obviously it's a different situation, but you can obviously get pregnant in the future. So that is one myth. The other myth that we face is that agar, like if I start consuming pills, yeah, if I have injectables, so I will start gaining a lot of weight. Again, this is not true. There's no scientific evidence that proves that कि अगर आप ये मेथड्स यूज़ करें तो दैट अगर फॉर एग्जांपल कुछ एवरीबडीज बॉडी इज़ डिफरेंट, ऐसी रेयर केसेस हुए होंगे कि दैट समबडी स्टार्टेड गेनिंग वेट। अब प्रॉब्लम ये होता है कि अगर आप रूरल कम्युनिटीज़ की बात करें, किसी एक के साथ कोई बुरा इंसिडेंट हो जाता है या कुछ हो जाता है तो पूरी कम्युनिटी फिर देन स्टार्ट्स थिंकिंग कि उनके साथ भी वही होगा। और आपको जैसे आपको तो पता ही है कि जैसे कि रूरल जो कम्युनिटीज़ होती हैं देयर सो क्लोज नेट के एक बात किसी घर में होती है तो हर पूरी मतलब पूरी कम्युनिटी को पता होता है, राइट?
And,
तो
and I want to say that not just rural communities, Anam, as a society, जहाँ जहाँ पे हम literate हों, elite हों, जो भी हों, we have that contagiousness in our word कि अगर कोई एक बात कहेगा तो वो वाइल्ड फायर की तरह फैलेगी and सब उसको believe करेंगे unless and until they experience it themselves.
Yeah, I agree. Like even yeah, also because of social media as well. Okay, I remember during the time of COVID, like in 2020, when koi vaccine nahi aayi thi or something, so people were like, if you use these herbs or if you use that or if you use this, it will. So people were coming up with like their own like thoughts and their own like ideas ke how we can prevent COVID. The point is ke it's now it's on Facebook, so other people are also wanting to follow it, or it's like it becomes a trend. And social media is also like you get like a lot of information from it. Ab zaruri nahi hai that every information you get is accurate, right? So I remember this very clearly there was like some, I can't recall right now, but during that time when there was no vaccine or everything, so people were like desperately looking for ways of preventing COVID. So there were these people were coming up with these like herbs, or people tried something and it worked for them, and then they spread it like wildfire, or they exaggerated it, or तो ये सारी चीजें तो होती हैं. So that's so yeah, that's quite like it does happen. And all these myths and misconceptions hinder you from seeking family planning at all. और जैसे मैंने आपको
Absolutely.
बताया कि that family planning is extremely crucial in our time, or especially for our country. I mean, we're the fifth largest in terms of population in the world. और आपको तो पता ही है that with regards to our development, with regards to our economic resources, or how many problems we face as a country. If we talk about shortage of water, if we talk about shortage of electricity, so it's all to do with the fact that if you had a more maintained population, if things were more planned out and all of these things, तो इतना ज़्यादा फिर वो basically impact नहीं पड़ता, and
Absolutely.
exactly. So
Absolutely. And one of the other things that I would just briefly before we close today's session is, if you like, you can give your view about it also, Anam, is कि बहुत सारी खवातीन बेशक गवर्नमेंट हॉस्पिटल्स में हों, प्राइवेट हॉस्पिटल्स में, बहुत सारी खवातीन जो लेबर इंटेंसिव नेचुरल डिलीवरी की वजूहात होती हैं कि दे डोंट गो फॉर इट या नहीं हो पाता, एंड वो सी सेक्शन करवा रही होती हैं. तो बहुत सारी खवातीन ने वापस आके ये बताया कि मैंने डॉक्टर को, मैंने गायनोकोलॉजिस्ट को बोला कि आप मेरे ट्यूब्स टाई कर दीजिए, एंड द डॉक्टर डिड नॉट टाई द ट्यूब्स. अगर आपका क्लाइंट, अगर आपका पेशेंट आपको बोल रहा है कि नहीं, दिस इज इट, आई एम डन विद इट, आप प्लीज़ मेरे ट्यूब्स टाई कर दीजिए. प्लीज़ 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 डॉक्टर्स, आप उनकी असिस्ट मत कीजिए, उनके डोंट नॉट असिस्ट देम, राइट? बिकॉज इफ अगर एक क्लाइंट या पेशेंट आपको बोल रहा है कि वी आर डन, तो प्लीज़ लिसन टू देम, लिसन टू देयर, दे नो देयर बॉडी. एंड फिर आप उनको बहुत सारी खवातीन वापस आके बोलती हैं कि हमें बोला जाता है कि नहीं, ओपीडी में आके डे सर्विस करवा लें. सो नो दिस कि अगर आप सी सेक्शन के लिए जा रही हैं, एंड इफ़ यू आर डन विद इट, सी सेक्शन इज़ द बेस्ट टाइम टू गेट योर ट्यूब्स टाइड. अपनी ट्यूब्स, अपनी जो बर्थ की नालियां हैं उनको टाई करवाने का, इससे कोई आपको कोई डिसएडवांटेज नहीं होगा, आपको कोई ट्रबल नहीं होगा, लेकिन बच्चे पैदा करने में आपको बिल्कुल एब्सोल्युटली 100% मदद करेगा. सो इट इज़ योर बॉडी, योर चॉइस. आप अपने आप को जिस तरह हेल्प कर सकते हैं. और जो मर्द हजरात सुन रहे हैं, जैसे कि अनम ने कहा कि आप लोगों की वजह से ख़वातीन का मुस्तकबिल बेहतर हो सकता है, उनकी सेक्शुअल रिप्रोडक्टिव हेल्थ भी बेहतर हो सकती है. सो इट्स इन योर हैंड्स. अनम, एज वी आर क्लोजिंग द सेशन, and your years of expertise and experience in this field of family planning and contraception. Parting words for people who will be watching and listening to you later.
The point that you had mentioned earlier regarding the healthcare providers not, like listening to the patients. We were also जैसे कि हम जो काम कर रहे होते हैं, तो it's very directed towards the ultimate beneficiary. तो बात हो गई कि जैसे कि the women and the men and जो भी young couples हैं, तो हमने ये भी intervention सोची है कि that we need to inform and we need to have awareness sessions for pre-service. By pre-service, I mean the healthcare providers कि उनकी भी awareness की जानी चाहिए regarding client rights. तो इस पे भी हम future में काम करेंगे that क्योंकि देखिए unfortunately the family planning and contraception, even in like let's say medical degrees, is not given that much weightage or that much importance compared to other topics, compared to like other fields of medicine. Like
Mhm.
other fields of medicine and health is more important. So that is one factor that these healthcare providers are not that well informed about client rights और उनके खुद के इतने ज़्यादा like they have their preconceived values and attitudes which prevents them from जिसके अगर उनका खुद का belief है कि नहीं ऐसे नहीं करना चाहिए that you shouldn't have like go for long term method or whatever तो फिर अगर उनका खुद का belief है they're going to put that belief on the client, right? तो ये चीज़ होती है. And as far as parting words are concerned, I just feel that I would encourage like young women and men and children to start talking about like it's important to know about your body, it's important to know about your health, it's important to seek information about family planning because ultimately this will lead for your life to be better and a healthier, more fulfilled life, not only for you but for your family. And family planning doesn't start, you shouldn't start thinking about it right after you're married, after 2 years, like after you've had 2 3 children. I think you should start it from the beginning. Okay, so that would give you a better idea of how to plan yourself, how to plan your life, and then ultimately you would be able to provide better resources to yourself and to your children. Thank you.
Absolutely. And as Anam said, early intervention is key और हम early intervention की बहुत अरसे से अब बात कर रहे हैं. So it seems like it's seeping through everything. Early intervention is key. It doesn't mean कि अगर आपको 2 बच्चे पैदा करने हैं कि आप पहले से अगर फैमिली प्लानिंग करेंगे तो आपको पता है कि इस दिन पे इस वक्त आप प्रेग्नेंट होंगे और इस दिन पे आपके बच्चे पैदा होंगे. नो, इट जस्ट गिव्स यू अ पर्पसफुल प्लानर. एंड जैसे कि हमारा बिलीफ है एंड हमने पहले बात भी की थी, जैसे कि मेरा बिलीफ है एंड देयर आर पीपल ऑफ अदर बिलीफ सिस्टम्स आल्सो ओवर हियर हु आर लिसनिंग टू अस. हम प्लान करते हैं और वो प्लान्स पूरे मुकम्मल नहीं होते बिकॉज देयर आर अदर प्लान्स फॉर अस. सो लिसन टू योर बॉडी, लिसन टू योर माइंड, अपने आप को लिटरली अवेयर करें और रीच आउट करें. अगर आपको कोई ऐसा आप किसी ऐसे मुकाम पे पहुंच रहे हैं जहाँ पे आपके पास सवालात हैं और उनके जवाब आपको नहीं मैसर हो रहे, तो रीच आउट टू ऑर्गेनाइजेशंस लाइक आहंग जहाँ पे आपको ये सारे जवाबात मिल सकें. सो थैंक यू सो मच Anam for your time. Thank you for bearing up with our internet connectivity, and as I speak Karachi mein barish has kind of cleared out as we wrap up this session, so I hope everybody stays safe and thank you so much for your time once again. Have a brilliant Sunday. Khuda Hafiz.
Thank you so much.